Well, I think the last time I did Zoom was, 2 weeks today? 2 weeks ago today. And the next day I was in the hospital. So, is that right? Yeah. So, I'm not going to go into all the detail other than I've probably been sicker than I've ever been in my life. It's always been hard for me to even talk about this type of illness that I have, is because it's a direct result of my eating disorder. It's a direct result of, as a young woman, having intestinal bypass surgery that was so dangerous that they don't even do it anymore. And that was over 50 years ago. And so every medical problem that I have is a direct result of that surgery. Now, the reason I do believe that I have, many of the folks that had the surgery have died. There's some that are still living, but many of them didn't live through it. So I know beyond a shadow of a doubt the reason that I have survived the surgery is that because of being in really good recovery and treating my eating disorder. And I didn't do it the first 13 years of after having the surgery. And so that fought against the surgery instead of me, they gave us no directions. They had nothing. That's just what it was. Nothing, no follow-up, nothing. And so, but after I got into good recovery for the last 36 years, I've been able to manage this syndrome. It's, my girls, I think, talked about it last week. It's called BADAS. You can look it up. And I never knew what I had. I know 6 months after I had the surgery, they diagnosed me with rheumatoid arthritis. And so I've had what we call a flare-up or a syndrome that comes on at times that usually when I'm doing the most and, working anyway. So this last month has almost been a blur. And, when you talk about being through the fire, we literally have been through the fire. Not only was I sick in the hospital, but our little town of Buffalo Gap and surrounding areas burned, and it's still, parts of it are still on fire, although we have had some good rain, but many people, 60, 70 homes were destroyed. It's been a sad thing, sad thing. So, the staff had to evacuate we had to evacuate Buffalo Gap, and they had to take our clients to a hotel. The clients went, the staff went, the pets went, the family went, and then Mama got out of the hospital and Mama got to go to the hotel. And I want to say that, in recovery, anything's possible. It's not what happens to us, but how we go through it. And I watched my daughters, and I watched Cam, and I watched Misty, who helped. I had to have 24-hour care. They stayed with me around the clock. And then my friend Cindy, who used to be my business partner, she helped my daughter Christy stay on the phone, and she's a nurse, and she walked her through the process that I was going through and all. So there was people involved in the process that helped my family. I didn't know what was going on. I don't remember much of it at all. I was pretty much out of it. But I want to thank those people. I want to thank in the hospital, that staff was wonderful to me. Absolutely. What I remember of them were wonderful. They were. I got good care. The only problem was our town here, and I'm not going to dwell on this, but our town is in a real upset, an upset as far as hospitalization. We have a huge hospital here that has bought out a smaller hospital, and they're kind of at odds. Long story short, I got to the hospital. My doctor did not have hospital privileges, so they couldn't admit me. So I was at the mercy of the hospital and their doctors, and that in itself presented a big problem. So I'm just saying that it was an uphill battle all the way, but I do remember one thing, my mother was a prescription drug addict, and I've had a fear because I do have that addict brain, and I've had a fear that of any prescription drugs, and I have been very leery and very careful of not taking mind-altering chemicals. Well, I would have taken any mind-altering chemical that they would have offered me. I was in so much pain. I've never had the kind of pain that I had. And so, my family watched that. They knew how I felt about medication, and I needed some. So I'm saying, if you go to the hospital and you can't be an advocate for yourself, teach your family to be your advocates. And that's kind of what I want to talk about today, is how important it is for us not to ever forget that we have an addiction. I don't care what the circumstances are, whether there's a fire and we have to evacuate. What, the staff and my family figured out is how to feed our clients abstinent meals, how to feed us healthy, all of that is taken into consideration in recovery. And I remember one of the main things I remember when they finally got me to a room is I said, no gluten or white flour. No gluten or sugar. No, and they put that on my door, no gluten or sugar. And, had I been there for other reasons, if I hadn't been in so much pain and so much distress, I would have really been more of an advocate for myself as far as my eating disorder. Most people who work in hospitals have, and I'm not faulting them, but they have zero knowledge of an eating disorder. Many of the nurses were morbidly obese. I'm not faulting anyone, but we must teach the medical people who work with us how to treat. I have a deadly disease called an eating disorder, and I don't care what other ailment I have. If that's not treated, if that goes by the wayside, I'm in trouble. And whether I'm for prescription drug addicts, absolutely they've got to go in the hospital with a plan, not only with the doctors, but with, their support, their AA, NA people have got to be there and be a spokesperson for them. So I'm saying all this to say, as I kind of came to a little bit, I didn't eat anything that they brought to me. I would look at those meals, and although I said no gluten or no sugar, the meals were not what I would eat on a food plan. So anything and I didn't eat much of anything while I was in the hospital. I couldn't, but what little I did eat, my family brought me. And because if I don't put my eating disorder first, I don't care what else I have, it's all going to get worse, So, and I could have had anything. I could have ordered anything I wanted up there, but I knew, and as out of my mind as I was, I knew, do not give any gluten or white flour. White flour or sugar. So I'm saying that to say, and it's really what I want to talk about today is, and I don't think we talk about it enough, as addicts, alcoholics, eating disorder people, that when we do get sick, we must educate the physicians who work with us. And I have really tried, I have attempted, I really didn't get this diagnosis of what this BADAS was until probably 10 years ago, and it came really from a little dermatologist that was brand new in the field. And I went to him because part of this syndrome, I would break out, and I don't anymore. I didn't this time, but I'd break out in like smallpox, it's on thighs and shoulders. And no one ever said have that biopsied. No one, any doctor never thought about it. So when I went to a rheumatologist, she said the next time you're in that syndrome and you have those bumps appear, go to a dermatologist and have it have a biopsy. And so I did. And the doctor was very new. That was the first week in that office. And all I needed was a biopsy. And so he looked at my paperwork and he said, I can't believe this. He said the last thing he was taught at Texas Tech was about this syndrome. And his professor said, you'll probably never see anyone with it because most of the people that have had that type of surgery have not lived through it. But this is, and they taught it. And so he got on the phone with my permission, called his professor and all that. And, he knew what it was. And from that point, I had a diagnosis. And I've had this for over 50 years without a diagnosis. So I'm just telling you that. And if there's ever anyone that you know that might have had that surgery, give them this information, because when you're in it, you don't know that it's caused from, directly caused from the surgery. So with that said, I want to, we have to help our doctors help us. And as addicts, the medical field, and y'all know this, through insurance and all of that, the medical field is changing. It is changing in ways that good health, to get good health, what you have to have is a partnership with your mental and health care professionals. And you have to teach them, because one of the doctors that I had up there, he said, we can't keep up with what's going on. He said that he'd been a doctor for many years, and he said, there's more sick people than I have ever known, and they're sicker. They're getting sicker, and there's more of them. I don't know what's causing that in our nation. I don't know. But from according to him, and that people are getting sick, and they're getting sicker at whatever they have. So it's important when we're in health to find a physician and be honest with that physician about, and you might have to, if you're going to a new doctor, if it's a doctor you've known forever, if they don't know about your addiction, you must tell them. And you might have to ask for more time, because most physicians, you're lucky if you get 15 minutes for an appointment. So you might have to ask for more time. You're worth it. And what it is about educating them on whatever your addiction is. Because if you don't, it's on you. It is not on the doctor. They cannot guess that if you're a drug addict or an alcoholic, and and you come in with some disease, and they want to prescribe this and that and something else, they will do it because that's what you have hired them on for. And you will get medication that is not good for a drug addict or an alcoholic if you don't have a voice in that. And so, this is why it is so important to sit down with your doctor, whether you have an eating disorder, drug addiction, alcoholism, and tell them your story. Tell them how it started, how long you've been in it, how severe it is, how long you've been treating it, how important your treatment is, and how you don't want, if you were to get sick, like I was, and I could not make any medical decisions for myself, zero. My family made them. And when you get to that point, your doctor needs to know what you want done in your body and what you want put in your body. Otherwise, they will treat you like any other person. They will not take that component, that addiction component, into consideration. So, and I see some long-term people on here, and you know what I'm talking about. You probably, every one of you probably have a plan for this. But I had a wonderful friend, and we sponsored each other. She was a physician in Georgia. She had no family. We were her family. She passed away 10 years ago. She was very ill with Crohn's disease and other things. And she was a prescription drug addict, alcoholic, and had an eating disorder. She did not have advocates for herself. And she had to have many surgeries. And when she would have surgery, the minute that medication hit that brain, she wanted more. She wanted more. She wanted more. She wanted more. So after we met and became close friends, she appointed me her advocate. So every time she had any kind of anesthetic or had surgery, I would go, I would work, I would be there. I would meet with her and the doctors. And she, we would talk about what they were going to give her and how much and how long. Because once an addict's brain does not know if you're getting medication, a drug, because you're ill or because you're an addict. Once that drug is put into that body, that brain says, give me more, give me more. So Kathy and I, and I was blessed to play that role in her life. And I'll tell you, it was not easy because she would have some kind of severe surgery where she needed some medication. And then they would begin to taper her off. Well, she hated me, she hated the doctor, she cussed us all out because she wanted more medication. And I would show her, her agreement was that we all signed, and we walked her through it many, many, many times at her request. This is what you have to get set up, particularly if you don't have family. Use your AA sponsor and your AA people to be advocates for you. And that brings up, and I don't see this as much in AA as I did in the early days. In the early days, and I say early days, I've been around the program for over 50 years, and a lot of hardcore AAs were totally against any medication. I don't care what it was, they were against it. And I remember there was a woman and she sponsored lots of people, she helped lots of people, and she was a prescription drug addict in recovery. And everyone that she sponsored, every time she saw them, she'd make them empty out their purses to see if they had anything in there, aspirin, anything. She wouldn't let them take anything. And so that was pretty much generalized in old-time AAers. And so, that brought on problems when people were really sick. I don't see that as much in AA. I think AA takes its proper place, and we need, when we do have any kind of surgery or anything, we need to have the backup of our recovery people, because left to our own devices, we won't relief, So, what I'm saying is, get you you're going to have a group of people, and I don't mean a whole group, I mean 2 or 3 people, advocates, a family member, your AA sponsor, someone that knows everything about you. And if you were in a car wreck or something happened to you and medical people were working with you, you need someone there to say, he is an alcoholic, he's a prescription drug addict. His request or her request is, we're not saying no meds, but we're saying low meds, and be careful of what is put in and keep account of it. Because like I said, that brain doesn't know if you're doing this for pleasure or if it's doing it to save your life. The brain wants more. An addict of a brain wants more of whatever the substance is. And that is with, for us with eating disorders. If you've been off of, and I've seen people do this, go to the hospital, maybe have 10 years of abstinence from sugar, and they're in the hospital, and they bring those trays, and they will eat the sugar, and instantly it will kick in that sugar addiction. And what they seem to think is in the hospital, well, it's okay because a nurse brought me. It's not, you've got to be your own advocate of what can go into your system without creating the desire to want more of it. That's your place. That's your job. And you got to teach, you got to teach the nurses and the doctors. Most doctors, unless they're recovering themselves, or unless they have had a family member, or unless they've had some interest in addiction, they know very little about addiction. Those of you who agree with me, shake your head yes. Doctors do not know a lot about addiction. It's your place to teach them, not about everybody's body, but about your body. You've got to be honest about it. And so, I was about the sugar. Now, had I been there for some other reason and not, completely out of my mind with the pain, I would have asked to speak to the dietitian, Not once. Now, in the paperwork, it said a dietitian would be coming to meet with me. I never saw a dietitian. Now, had I, needed that, I would have requested a dietitian, and I would have gone over my meal plan with them. That is something that I would need to do. I didn't because I was too sick to eat anything. But anyway, what I'm saying is tell the medical people the truth. When you go to the hospital, you're not on a vacation from your addiction. I was given some very heavy duty drugs. I mean, heavy duty, because the pain of what I had, the arthritis, I've never had pain like that. But I came to my senses, and once I got to feeling better, I could have had the pain medicine, every 4 hours, every 6 hours, whatever. But I knew in my brain that because I have a brain of an addict, that if it felt too good, I might want more of it. And so by the time I left the hospital, I was off of all off of all the medication other than Tylenol. And they sent me home with the medication, and I'm not going to take that. Now, if I get really, really bad with the pain, I will do it. I might take one, but I will do it with witnesses, because, and I keep going back, my mother suffered from prescription drug addiction all of my life. And doctors are trained, this is how doctors are trained. They listen to symptoms. You go in and you tell them your symptoms. And they usually listen with a kind heart. Physicians want to make us better. And they're trained, you give the symptom, they're trained to match medication with the symptom, particularly more in today's time than ever. Doctors are bombarded in their offices every single day from these, what they call detail people. They are salesmen for prescription companies, and they want to sell the doctors on their prescriptions. And more prescriptions are given out today than ever in the history of medicine. And there are some good medications. I'm not putting medication down. But as addicts, you have to be your own advocate. And when you get to a place like my friend Kathy, where she couldn't make that decision, she appointed someone who loved her a lot and her medical team to make those decisions for her. And another thing, when you have that, if you're a real alcoholic and drug addict, and you've been in the hospital and have had mind-altering chemicals, you need to request for at least 48 hours of detox before you leave the hospital. You need to be detoxed from those drugs at least 48 hours. And that's where you're going to have to be your own advocate. You're going to have to speak up. And if that chemical has already kicked into the brain, you won't want to stop it. And that's where your team, the people, your advocates will speak up for you, but if you have some kind of major surgery and you absolutely have to have medication, go in with a plan and tell the doc, I need 48 hours of detox from these meds before I leave the hospital. That's taking care of yourself. And if your doctor won't listen to you, find you another doctor. So, and like I said, I don't want to wear this down. Educate your physician, particularly with eating disorders. Doctors do not know about eating disorders. Do y'all agree? Unless they have one, unless they've had a family member, unless they've had some interest in really researching it, or maybe there are docs that make that part of their practice, which that's wonderful. But if you have an eating disorder, you must teach that physician, because what they're trained to do is write scripts. And if you're obese and you go in and you're overweight, you need to lose this much weight in this amount of time. And I've just got this new medication and that might help. And he'll write you a script, and that is deadly for an eating disorder client. So go in smart, learn about your eating disorder and what you can do and what you can't do. And, and take your food plan serious, because they do not know to take it serious. If you're an anorexic and, you go to the hospital and you decide, and our brains can kick back into that eating disorder in a heartbeat. So you're a recovering anorexic and you're in the hospital and your brain thinks, well, I might just deny the food, for a few days and I could lose a pound or two. That's why you've got to take your sponsor with you and speak this stuff out, because that eating disorder, I don't care how much recovery we have, it can come back in a twinkle of an eye. But as out as I was, I remember being wheeled into that room at 11 o'clock at night, and I said, I can't have gluten and sugar, and they didn't give it to me, but they didn't give me a good meal plan. But anyway, that's all right. So beating this to death, educate your doctor and get honest about what you do with food. And sometimes they are appalled about what we do with food. They don't know. They don't know how many laxatives we take a day, or how many times we purge, or how much we overeat. My little husband would say, when I weighed 280 or 287, he was skin and bones, and he would say, well, I don't know how in the world Tennie is overweight, because she hardly ever eats anything. Well, not in front of him, I didn't, I was a secret eater, And so, did I tell the doctor that? Did I go in and say, I eat everything I can get my hands on? I want him to find, or any doctor, I want him to find that I had a bad old thyroid problem is the reason I was overweight. Well, I've never had a thyroid problem. It is overeating. It's the food. I'm a food addict. I never could get enough. I get enough today. That's one of the reasons that I saw in the hospital that I am in good recovery by the grace of God and folks like you for my eating disorder, because the food has taken its proper place in my life. Do I think that it couldn't get out of order in a heartbeat? It could, but it hadn't for many years, and I'm so grateful for that. But it's still my responsibility to be an advocate for myself and talk about what I can put in my body and what I can't put in my body. Okay, so when you're educating your doctor, and see, I have tried for the last 10 years to educate the health professionals that worked with me. Maybe one doctor read that, one of the medical doctors, maybe only one of them read, and it's all in, you can Google it, the information is out there. They don't have time, I guess, I don't know, but I don't think anyone ever took time to actually see what I was dealing with on a daily basis. So we got to the hospital, and my doctor couldn't be there because she didn't have hospital privileges. Long story short, I needed a good doctor. And I want to tell you, my youngest daughter, Christy, and her brother, Kelly, they got their heads together. And Kelly has a wonderful doctor, a group of doctors. And before I left there, 2 days before I left, she was my doctor, and she came in. And before she came into my room, she had read everything about this syndrome. She hadn't even met me. Oh, I'd met her at a party one time, but not as a patient. My daughter told her what it was. She went, got the information, and this is a busy doctor. But by the time she walked in my room, she knew what the problem was. She'd read it. She's going to do more research on it. I believe I finally have found someone that will take the time to really help me, because I want to live to be 100 or 105. But the rate I was going for this 2 weeks, I'm not going to. So I'm grateful. I'm not grateful I had to go to the hospital, but I'm grateful for what we've learned. And I'm grateful that I've come out with a doctor that has already researched the syndrome. And, you know, and then I've got a blood doctor, and then I've got a heart doctor. I didn't know I had a heart problem. That came up, and it's all workable. It's all workable. But because of going to the doctor, then I found, you know, I have a heart doctor, a blood doctor, you know, so, and primary care. So I've got me a whole group of doctors that are going to help me, and I'm grateful for that. But it's because my daughter, Christy, took the initiative to, and her brother, to fight, you know, mainly Christy. And you have to have a spokesperson in the family that will do that. Otherwise, you know, I was laying there. I could not be a spokesperson for nothing. I couldn't get out of bed without help. I couldn't go to the bathroom without help. I couldn't, you know, how vain I am. I was not vain. My hair was awful. It was grown out. Half of it was white, half of it was black. I didn't care. I didn't care. I was in so much pain. Okay, so I want to, we've already talked about their doctors are trained to listen for symptoms and match the medication with the symptom. Be very careful about the medication, particularly if you're a drug addict and alcoholic. Don't go in there by yourself, because your addiction might show up. You know, if you're have been, you know, you pick the drug. You know, if you've been on a certain drug and that's the drug that doc wants to give you, you're an addict might say, oh, that'll be all right. Don't believe the addict. You have an advocate go in there with you, you know, like your AA sponsor or someone that will keep you honest, because we don't, sometimes because of our addiction, we want what we want when we want it. And I've seen people lose. I mean, we had a beloved man that started the AA program at Big Spring State Hospital many years ago. He was wonderful, wonderful. 25 years sobriety. He was one of the very first early workers in the alcohol drug field. Everyone in this part of West Texas looked up to him. And this is something I'm speaking out now for those of us in the field that are also addicts. We must take care of our addiction before we take care of anyone else, or we're not going to have anything to give anyone else. But this man was big in AA. He was a circuit speaker, or around community speaker, not over the United States. But anyway, he knew AA inside and out, had 25 years of sobriety, but he was working with alcoholics every day and working with the state and doing this and that and something else. And he got tired, and he got too tired to go to meetings. He got too tired to go to meetings, quit going to meetings. And one day he was checking in a guy into detox. He didn't normally do that, but he was in there by himself. He collected the medication, and the guy had those red mollies. Any of you drug addicts probably know what I'm talking about. Very, very strong medication. He took one, and that set him off. That probably a year and a half later, he died of addiction. That's how serious this stuff is. And that's how serious it is for medical people who work around. I mean, some of the highest rate of prescription drug addiction is with doctors and nurses, particularly your nurses. You know, so this is why we must educate everyone. Anyway, I can get off on all sorts of things. But, you know, that's a man that we watch die of addiction because he gave up his program. You know, we can know everything there is to know about the program and die of addiction if we don't practice the principles on a daily basis. And it's same with eating disorders, the same. You know, we only have a daily reprieve. Today is all we have. You know, you're not certain, I'm not certain that, you know, I'll be abstinent tomorrow or next week or 10 years from now. You know, my plan is for that, but my plan is today. I'm going to be absent. I'm going to take care of myself today. And I know those of you that are on here, that's your plan. But we must treat this disease daily, and that's what the medical profession don't understand. And you must teach them that. And if, you know, like if you're have an eating disorder and you go to a doctor, take them OA material. Put it out in their office. Ask if you can put it out in their office. Let them know. There's less information out about eating disorders than there is about drugs and alcohol. So go when you go to your medical people, talk about your program and how it's helped you, and maybe they will refer. Very few doctors we get very few what am I saying? We get very few recommendations for treatment from doctors. Very few, because they don't know to really recommend treatment until people get so bad they're at death's door. That's when they'll recommend an anorexic go to the hospital. They'll very seldom, ever, I don't guess I've ever got one, a morbidly obese person from a doctor. They don't refer to treatment. They don't. They say you must lose the weight. Here's the way you do it, and here's a prescription for, that will help your appetite. Or they will tell you about the surgery, and they're sincere. I'm not down in it. They don't know. So we must teach them the difference. And if you're in recovery, and everyone I say on here is, I'm not preaching to you, but I think we all have an obligation to teach people, particularly the medical profession, about our disease. I think we have an obligation to do that, not so much for ourselves, but so they will know, because when we get in our disease, we lie. I don't know. I mean, have any of y'all ever lied to get what you wanted? Have you ever lied to a doctor? I went to an internist here in this town for years, and my liver was almost shut down. Do you think I ever once told him, well, Doc, I'm taking 100 X-Lax a day? Do you think I told him that? No. One thing, I had so much shame about it, and the second part of it, I didn't want to stop doing it. I did not want to stop doing it. So, we're going to have to be honest with people if we want help from the medical. All right, so promote your recovery, your wellness in every area of your life by living a healthy lifestyle. I've been, and y'all know, I've been on that no smoking train forever and always, amen. And through education, smoking is down more than we've ever thought that it would happen. But if you are in recovery from drugs, alcohol, and an eating disorder, and you're smoking, you are using a drug, and it will kill you as quick as any other drug. A drug is a drug is a drug. And we treat people with anorexia or any eating disorder, and they come in, they stop smoking, they may be getting good recovery from their eating disorder, and they quit drinking, and they'll go back to smoking. I've seen it over and over and over again. So if you want to live in health, promote your wellness in every area. Live a healthy lifestyle. No smoking. How many times have you heard proper exercise? And I've got a physical therapist coming at 4:00 today to help me find a plan where I can exercise with arthritis, to where I've got to keep moving my body. That is the number one thing for arthritis, keep moving. And when it hurts, you do not want to move. So I want to work with this physical therapist, and I have a lot of hope that he's going to help me. And another thing is reduce stress. We have, the last 2 years, our nation has been under so much stress. Have y'all had more stress the last 2 years? I mean, across the country. And so do what you can do to lessen your chances of getting sick and needing any kind of treatment, because when we get sick in one area, if we're not careful, that the eating disorder and the drugs and alcohol will kick back in a heartbeat. Okay, so if you find yourself in the hospital, maybe having surgery, I've gone over this, tell your treatment team before you ever get on that surgery table about your drug addiction and alcoholism, and have a plan going in, how long you're going to stay on the meds, because I'll tell you, once they start the meds, you'll want them. Nurses, you know what nurses want to do, and doctors, they want to relieve your pain. You've got to teach them that you can go through a certain amount of pain, that, you don't have to continue that pain medicine, because when your brain gets kicked into that, we had a nurse, 10 years sober, 10 years sober, good member of Alcoholics Anonymous. I can see her in my mind, good member of Alcoholics Anonymous. She had surgery. She got strong meds, and she liked them. She never came back to AA. She lost her license. She died of addiction. That is how serious this stuff is. Okay, all right, you must advocate for, be an advocate for yourself, or have a family member that will. If you're not, capable to speak for yourself, make sure you have your family. If you're going in for surgery and you have an eating disorder, make that a part of the seriousness of your program. Talk to the dietitian and talk about your meal plan and what you need and want. Their job is to do that, and they will. They'll accommodate you, but you've got to ask for it and take it serious. Okay, so I think that is, and then I want to stress this again. If you do go to the hospital and you're under any kind of medication, stress to your team going in that you have got to have some time of detox before you go home. Because otherwise, what they'll do, and they do it out of the goodness of their hearts because they don't want patients to have pain, they will send you home with the same medication that they've been giving you. And you must ask, if you really want to stay in good recovery, you must ask, I need to get off these meds before I leave the hospital. And I need at least 48 hours to detox. And in today's time, that's difficult, but you need to be that kind of advocate for yourself. Because if you go home with those meds, I went home with Kathy over and over and over, and she was a physician. She knew that. She was an addiction specialist. I stayed with her 3 weeks when she had shoulder surgery. She begged me for drugs every day because the pain was so great. And I was the one that had to say no, or had to dole it out just a little bit, because when the pain comes up, the brain knows the sense of ease and comfort. And for an addict, we get more of a sense of ease and comfort. We get that emotional comfort, that easing of the pain, not just the physical, but the mental and emotional. So that's what I have. What do y'all have? Because there's some people here with long-term recovery. Have you experienced any of this, or any questions that y'all might have, or whatever? And it's good to see all of you. Who would like